Hi, I am Dr. Natesh, Senior Consultant Orthopedic Surgeon and Professor of Orthopedics. And I am talking about knee pains. There are different types of knee pains. Most commonly what we encounter is traumatic knee pain. When we have an injury to the knee joint, whatever pain that arises out of the trauma, secondary to the trauma, that is called traumatic knee pain. And the second most common will be infective, maybe some septic arthritis, maybe because of some inoculation of some bacteria inside the knee joint. That is one cause that may cause swelling and knee pain. And the other common cause is immunogenic, like there can be idiopathic synovitis of the knee joint or post some viral arthralgias like dengue or chikungunya. Such things can cause arthritis and synovitis and knee pain, swelling of the knee joint, as well as rheumatoid arthritis. They are all secondary to immunogenic process. So, and very rarely it can be because of some tumors also. So usually knee pain has so many origins, and depending upon the cause we have to treat them. Coming to the main reason of knee pain, the main reason usually will be injury and infective causes, either a viral infection like chikungunya, dengue, or infective causes like bacterial infections and all, when especially when patient is immunocompromised, like tuberculosis also can cause swelling and infection of the knee joint. And most common will be traumatic. For injury to the knee joint, it may not be a straight direct hit over the knee joint. It can be as mild as a twisting injury, and it can happen with just getting out of the car with your knee joint in a wrong position and loading the knee joint in that position. That can cause injury to the meniscus inside the knee, and that itself can cause knee pain. So, what are the causes of knee pains in teenagers? Teenagers usually they may be having, most common thing is ACL injuries or meniscus injuries, because they tend to be very active, and their lifestyle will be very active. They will be hopping around, and that may cause some injury to the knee joint, especially when running and jumping from height. And the precautions people of all ages should take to prevent knee pains are people should develop a habit of squatting and doing regular exercises for the knee joint especially. And once you squat and do the exercises for knee joints, the cartilage and the surface of the joint will have good nutrition, and it will be healthy. And maximum flexion and extension of the knee joint will help in proper processing of the muscles around the knee joint, and also strengthening of the muscles around the knee joint, like quadriceps exercise, hamstring, VMO exercises, strengthening exercises. All these will help in offloading the knee joint of weight, and it in turn gives good relief for the knee pains, as well as protect knee from any injuries. So the treatment for knee pain can be varied. We have to identify the primary cause of knee pain, and whether it is because of the trauma that has occurred, is there any structural injury to the knee joint, cartilage, meniscus, ligaments and all. That is one aspect. And if we rule out the traumatic issues, then we have to see the reason for the pain from the knee. And the reason has to be identified, it has to be evaluated, verified, and then we have to eliminate the reason completely. Then only we will be able to treat the knee pain. So it's not like one size fits all. We have to identify the reason for that particular age, and then we have to treat accordingly. The most common kind of knee surgery is knee replacements, and knee replacement usually will be done around 60 years of age and above 60 years of age. And for those people, we have to evaluate the cardiac conditions, the renal issues and any other health issues that the patient is having before the surgery, and we have to take cardiac clearances and all, and then we have to go ahead with surgery with proper planning. Coming to the implants that we use for knee surgery, almost all implants are standardized now, and best to have surgeon preference over the implant. And usually most of the surgeons, they use at least 3 to 4 kinds of different implants, and the patient can choose one among them. It is not difficult to sit or walk after surgery. In fact, patients after knee replacement surgery also they walk and sit. And coming to sports injuries, the patients will be able to get back to previous level of activity, previous level of professional sports at around 5 to 6 months of time from the surgery for any ligament injury. So there is no point one has to have any doubt in their mind regarding surgery. Of course, they have all surgeries will have their own set of complications, but usually it is around 1%. So knee replacement surgery will last around 20-25 years, and if a patient gets it around 60 years of age, once for all surgery, and usually they don't require a repeat surgery. But of course, in some cases, when knee replacement surgery fails for some unavoidable circumstances, unavoidable reasons, either from the patient side or from the doctor's side, they can be redone, and the case has to be evaluated, and we have to assess the reason for failure of that particular surgery, and then we have to reassess, and we have to do a redo surgery in that particular patients on their knees, and those cases are very rare. After the operation, patient will be able to immediately walk because of the nerve block. The surgery will be almost painless surgery because of nerve blocks, tissue blocks that are given, and advancements in anesthesia and minimal open surgeries and minimal handling of soft tissues. The postoperative pain is significantly reduced, unlike years where 10-15 years back the pain used to be very high and the patient used to have 2 to 3 days of bed rest. Same day evening, in these days scenarios, almost every center, same day evening the patient will be able to walk because of the fantastic anesthesia advancements, nerve blocks that we give, and also the minimally invasive surgery that is done.